The point about repeatability is interesting. And I think that, and Dave, when we were talking and preparing for today, you talked about consistency and quality and such. I think that in industry, at least in the pharmaceutical and biotech world, if something is going to translate into a product down the road, it has to meet certain quality standards that meet a regulatory metrics, say FDA. And I don't know how much our faculty are necessarily trained or groomed in that way. So can you speak? Maybe Roy, you can start and speak to that. That, because I guess it would have to be repeated by industry to start down that standardized path.
Yeah, so absolutely. And there are statistics about how many actual publications are even reproducible. There are many papers where somebody's discovered something and they're actually not using the cell line that they say they were because they've made mistakes on all of this. So there's a lot of that going on. The other big factor is from the rush to write papers. This is the academic requirement. You get a new result, you publish it straight away. You don't necessarily repeat it another 400 or 500 times to see, does it always happen? Why it doesn't? You may drop out a few. Well, I know why that experiment didn't work. I can ignore that one. Not saying it's deliberate fraud or anything like that. But the magnitude of an effect may be much less when it's been reproduced many times. And that's the requirement in industry. They're going to have to take this data all the way through and invest for a drug. This could be $1 billion, more than $1 billion. You don't want to start on some fuzzy data in the beginning. So,
I think the phrase trust but verify
yes,
has definitely been representative of my experience. The other thing that we found is that a lot of our studies are in smaller animals. And at least in the heart, there's a certain punch or a certain validity that comes with larger animal models of the heart that may more closely resemble the humans, but yet those aren't animals that would traditionally be used in basic science studies. So what we found with one of the compounds that we worked with is that we saw efficacy in rats and mice, and then it was trust but verify, and that verification actually came in larger animal models that have a better track history of predicting translatability from the basic science side into a clinically relevant population. So that's certainly been our experience as well. Okay, that looks good. Let's see if it's real or not somewhere else.
So was it? So I'm dying to know. So some rodents.
Yeah.
To industry's larger animals.
In this case.
Was it in this case reproducible?
It was. So in this case,
Wow.
this was a company that didn't have their own wet lab space, so they just contracted out with other academic centers that had some larger animal models going. So it was tested in rabbits, dogs, and sheep, and also the efficacy was there. So whether that even goes to the next level, we'll find out.
I was going to ask you that.
Yeah, it's underway.
At least from my experience in the tech transfer world, our goal is, and it sounds cruel, but it's true and honest, it's better to kill a project early than have it a long, languishing period of non-productivity. And I believe that's a standard in industry, because we all cannot continue to expend. You have more financial resources than we do, but nonetheless, you cannot continue to expend money on a project that is not going to be productive.
That's right, Marty. By all means, it's the same mantra in industry. It's kill early because Roy mentioned the $1.2 billion of direct, indirect costs to take a target through a compound through clinical trials to approval. That's direct and indirect costs, $1.2 billion as of 2010. So probably more today. But that's across the entire pipeline, right? So yeah, you want to kill early. It occurs to me, just to spend a minute, that there's the interesting tug about killing early is that, and it's no different in industry than in academics, is a bias is there, right? It's really hard to kill. You kill one of your babies. It's a new target. You discovered it, and in looking at a rich data set, which we should all be using, not a limited, selected data set, but looking at a rich data set, one is really able to, it's easy, really, in almost every case, to find a trend towards positive. You can select out and pick and go. If we just repeated the experiment with a few more animals or a different species and dosed a little differently, I think I could pull those out. And so it's a post hoc analysis. And industry leaders, my bosses, really, again, were very skeptical, and there was a high stringency, and they could see through that. But I tried, and I'm sure people here at ECU do that too. It's really, it's a type of bias.
As I think